So I will just, this is the last part. I will just show what has been going on in Asian Hospital in the past 2 years, no? So this from here, this is 2 years ago, and then last year yung towards your right, no? So just for you to know what this graph is about, no? So yung mga bars na green na yan, yun yung inpatient days, no? Siyempre, pag konting na-admit, tapos hindi ganun katagal sa hospital, mas mabababa. Importante lang makita nyo dyan is, tingnan nyo, from 2022 to 2023, dahil nga natatapos na yung pandemic at that time, no? Dumadami na yung admissions and the inpatient days, no? So, siyempre, pag mas madaming pasyente, the infection risk goes up, no? Kasi mas maraming pasyente, mas maraming kailangan alagaan, no? Kung titingnan nyo, noong 2022, yun sa baba naman, yung umaakit baba na black line na yun, those are, of course, yung high, no? Yung highs natin. Hospital acquired infections. So, nakita nyo dati, konti lang yung inpatient days, pero mas mataas ng konti yung highs natin, no? But with infection control measures, hindi nakasulat yung sa taas, hindi nyo na kailangan basahin. Medyo, and despite the increase in inpatient days, bumaba yung ating yung highs, no? May konting surge nung October, November, pero not as high as the previous, no? So, kumbaga parang we are able to control highs despite dumadami yung inpatient days, no? E tingnan natin sa VAC, no? Ventilator-associated pneumonia, no? May nakasuksok sa mouth until the throat, no? Tumaas din yung inpatient days, of course. Pero tingnan nyo, since October of 2022, wala tayong ventilator-associated pneumonia. So that is dati meron, institution of measures nandun sa taas. We don't need to go through them one by one. Pero naibaba natin to flat, no? To zero, no? And then same with catheter-associated UTI, mas nahirapan tayo ng konti kasi tingnan nyo, meron nung early part of 2022 na ibaba ng konti, then may konting increase, and then so far, since May of 2023, medyo good na naman, mababa ang ating highs. No? So that's another successful graph, no? Yan, sa central line associated bloodstream infections, no? Ganun din, same story. Mas mataas initially, may isa lang na medyo tumaas yung cases noong March, pero naibaba ulit. October, November, not so much, and back to zero in December, no? So, yun yung natin, yun yung laban natin, no? Kasi yung mga mikrobyo, lagi kong sinasabi, walang isip yan. Very selfish. Gusto lang nila mag-infect. Kasi ano bang ginagawa ng mikrobyo sa katawan natin? Ba't nila gusto pumasok sa atin? Kasi ang katawan natin, merong oxygen, merong tubig, merong sugar, may pagkain. Yung mikrobyo na yan, gusto sa loob natin. Kasi lahat sila, makakuha sila ng all of those things, no? And that's why they want to enter our bodies. Our, we don't want them to do that, no? Kasi para sa atin naman yung mga pagkain, water and oxygen na yun. Same with surgical site infection. Nakikita natin medyo from time to time may mga spikes, pero past 4 months of last year, the last 4 months of last year, maganda din. No? So that's the summary. No? So in summary, I don't need to go through this kasi nakita nyo na yung graphs. Kita nyo na pababa talaga lahat. No? So our main goal is to hopefully all of you will continue to help the whole hospital in your respective units for us to be able to keep those numbers low. Now, ngayon sa baba, yung last two, no? Hand hygiene. 2022, 82%. So, ibig sabihin, 8 out of 10 hand hygiene, no? In general, no? Nataas natin to 84%. Pero we need to work on that. So like I said, it was number 1 on the standard precautions list. Maybe we can start with that. Remember to always do hand hygiene all the time. And which moments sa patient care makikita natin namin. Of course, bundles of care compliance, that's for yung yung bundles and catheter, UTI bundle, back bundle. So, kailangan natin improve yan. Kasi 76, naging 79, pero we wanted, syempre, mas maganda, no? If it's in the 90s. No? So, bundles of care compliance, ito naman yung mga strategies that when bundled together, mas maganda yung effect. So, those are things if you are in a specific area in the hospital, no? Lalo na sa ICU, mas ginagamit kasi yung Foley, central line, intubation, of course, in the ICU. Now, ito lang kasi I just wanted to show na yung sa baba, yung orange is that's the bundle compliance. Ano tama ba? Sorry, yung blue yung bundle compliance. No? And then, yung orange is the high rate. No? So, nakita natin na nung first part of 2022, medyo bumaba yung bundle compliance natin. Okay? So, dapat in your respective area, pag merong naka-Foley, dapat may UTI bundle. Pag may naka-intubate, dapat may back bundle. Kasi para mabawasan natin yung chance. So, kung titingnan nyo, mababa yung initial part ng compliance, matataas yung high. Pero eventually, naitaas natin, pero it really took much effort. Tingnan nyo, ang hirap. So we really need your help in these bundles. If there's a bundle that needs to be done, make sure that it's being done in your units. Medyo bumaba na rin naman yung high. No? So these things work. No? But of course, hand hygiene is number one. No? Ito yung moment 5. No? And later we'll show you the different other moments. But tingnan nyo, mahirap eh. Minsan, maakyat baba yung hand hygiene compliance. But we need to make it a habit. It needs to be a culture, and because that will really, really help our patients. No? Biro mo, nasa konsensya natin, for example, hindi tayo mag-uusang tapos na introduce natin yung bacteria natin sa patient, or galing tayo sa ibang pasyente na may mabagsik na mikrobyo, tapos hindi tayo nag-uusang kamay, nadala natin sa ibang pasyente, diba? So we don't want that to happen. Or baka madalaan sa pamilya. But if we make it into a habit, bumababa yung chances na maka-transmit tayo to patients and to our family. No? And even to ourselves. No? Minsan, hawak ka na sa pasyente, madumi, may mikrobyo. Umawa ka sa mata mo, naku, makakapasok na siya sa iyong katawan. Kakasakit ka na. And these are the 5 moments of hand hygiene. I know these have been discussed with you, but just a reminder, perform hand hygiene before touching a patient, before doing a clean or aseptic procedure, basta before doing a procedure na lang. And then number 3, after body fluid exposure risk, no? After touching a patient, and number 5 is after touching the patient's surroundings. No? That will really reduce the chances of us transmitting infections or us getting infections also. So flu vaccination, ang importante lang dyan yung 90+% yung vaccinated. No? So syempre, if vaccination, we have proven that it really works. Dati pa naman, even before the COVID-19 pandemic, naging question mark lang kasi bago yung vaccines. But as you can see, 2020, pagpasok ng mga COVID-19 patients, ang daming mortality, ang daming morbidity kasi mabagsik yung COVID-19. So, ang dami natin precautions, which whatever we discussed earlier, ginawa lahat yon. And then dumating yung mga bakuna. Pagdating ng bakuna, bakunahan na tayo, kita naman natin na unti-unti bumaba yung bagsik ng COVID-19. No? Until eventually ngayon, parang common cold or flu or trangkaso na lang siya. So vaccination really helps. No? And the benefits really outweigh the small risks. But this is our main problem at the moment. No? Okay? So, tumataas yung mga natuturok sa atin accidentally, no? So, we really need to work on this, no? Yung needle stick injury, okay? Kasi, maraming bagong nurses din, no? Busy, nagmamadali. But with precautions kasi, we really need your help in trying to, make sure na we protect ourselves. Kasi tayo yan eh. Usually tayo yung needle prick, no? So kailangan natin babaan so that we don't get unnecessary viruses, no, or infections just because of a needle stick, no? So, ito, most common habang ginagamit yung needle, no? Accessing IV line, handling specimens, passing of yung needles, no? Collision with sharp or a worker, insertion of removal of needle. So these are things that we have data on. And alam nyo na, dyan nangyayari most of the time, almost 70% of the time is during use. So when we use these needles, no, extra care please. And there have been strategies that have been in place. We just need to follow those, and we have to remember that the protection is not for anyone else but for us, for you, no, who's handling those needles. Of course, during or after disposal, after use, before disposal, should also be, you should also keep that in mind. No? So we need all of you, okay? We need all of you. So we are really hoping you will be Abe Lincolns in our in your respective units. No? So that's it. These are my references. No, you can go through these references. But as a summary, no, sinabi ni Justin na a couple of books. As a summary, I will read to you a poem I made specifically for you. Okay. Ang title nito is Impeksyon, Iwasan at Kontrolin. Siyempre yung sagot, hype. Okay? Ano ba ang hype? Opo sa hapon, pero sa ospital ay impeksyon na wala pa pag-admit noon. Galing ere, tubig, lupa at buwan. Kung kaya ingatan natin sila, ang nasa ICU mahihina. May gadget, kondisyon at iba pa. Ingat sa linyang sentral sa sonda. Pati na din sa tulong hininga, mga ventilator na makina. Pati na din sa pag-oopera, dapat mag-ingat ang bawat isa. Ang ospital natin may programa na ngayon kinakailangan ka para maputol na ang kadena ng impeksyon na sana'y mawala. Tandaan ang standard precautions. Lahat ay dapat sumasang-ayon. At ang kontra naman sa transmission, ang pagsuot ng guwantes at gown. Nababa ang high ng 2 taon. Konti lang sa linya at operasyon. Mga nagkaroon ng impeksyon sa ihip dahil sa intubation. Huwag kalimutan maghugas kamay. Importante talaga mga bay, bago at matapos humawak kay pasyente at paligid din, okay? Sundin din ang mga pinagsama na panlaban at estratehiya. Kita naman, di ba? Gumagana. Ang tusok karayong problema pa. Kaya kailangan namin kayo. Di malulutos to ng isang tao. Doktor, nurse at lahat ng trabaho may matutulong sa labang ito. So thank you so much. Okay? And if you have any questions, I would love to answer them.